Hello everyone, I'm Dr. Bang Ji-sung, the hair wizard, here to protect your hair. It's truly a pleasure to meet you all.
Hello, I'm Jason, the hair YouTuber.
Nice to meet you.
Yes, so today I'll be asking the director all the questions I've collected from my subscribers. As for me, I don't smoke at all, and I hardly ever drink, perhaps only about once a month. Consequently, many individuals who frequently smoke or consume alcohol are quite eager to know if these habits impact their hair transplantation outcomes, what actions to take if there's an effect, or if complete smoking cessation is necessary. Therefore, could you please enlighten us on the proper course of action for them?
Well, there's no single perfect answer. If your body is in great shape, you're very healthy and full of vitality. Therefore, drinking and smoking likely won't have a significant impact. They also serve as a method for stress relief. For instance, if someone who smokes 2 or 3 packs daily abruptly stops, they will experience withdrawal symptoms and their stress won't be effectively alleviated. People make various efforts to get good hair transplantation results, and among them are smoking cessation, alcohol abstinence, and for some even celibacy. Therefore, consuming less alcohol, smoking less, and refraining from harmful activities benefits both your general health and your hair health. But you shouldn't just do it for a day or two. You really need to be doing it for 6 months to a whole year. Therefore, you must honestly assess if you can consistently maintain that commitment. If you're really committed, significantly reducing your smoking and alcohol intake for about a week post-surgery will definitely be beneficial. There are indeed such individuals. When looking at the post-operative progress, many who seek revision surgery after a procedure elsewhere complain that their results were still poor, even though they committed to smoking cessation and alcohol abstinence. In those cases, it seems they likely didn't drink enough water or manage their stress properly, on top of quitting smoking and drinking. Therefore, strictly quitting smoking and drinking doesn't necessarily mean superior surgical outcomes. However, smoking cessation and alcohol abstinence can be helpful in the early stages, that's what I can tell you.
And secondly, there are individuals who need to engage in physical exercise. They should exercise diligently once a day, but from what I've gathered, you previously advised against intense exercise for about a month. Do these actions really make such a significant difference?
Exercise helps with stress relief and improves blood circulation. Therefore, individuals who habitually exercise should exercise caution during the initial day or two. Furthermore, some medical facilities might even restrict all forms of activity for as long as a week or even 10 days following the procedure. Therefore, once the surgery is complete, you should consult with your doctor about that. The amount of bleeding and the condition of the wound varies from person to person. But for my patients, I usually have them start aerobic exercise on the 3rd or 4th day. In fact, I strongly recommend that they resume their regular exercise routine by the 1-week mark. It's not a general rule that you can start after a week, it's more that it won't cause any major problems. I'd say it depends on the state of the surgery and the post-operative progress.
Some individuals, due to their profession, must wear hats. They often ask if it's permissible to wear a hat after a hair transplantation, given that it applies pressure to the scalp. This is a very frequently asked question.
People get quite stressed about it, not only hats but also wigs. Anyone who wears such items on their head tends to be concerned. I believe I've brought this up before, but wearing hats doesn't really pose a significant problem. In my experience, many patients go home wearing a hat right after the operation, which doesn't significantly impact the results. Yet I must highlight a crucial point. If you wear a hat that's overly snug and don't take it off all day, a style like that is risky. There's no issue if you're just putting your hat on and taking it off. But if you take it off and there's a distinct indentation, and your scalp, which felt numb, now feels refreshed and relieved. Those individuals are wearing it excessively tightly. In such a scenario, wearing it a bit more loosely would likely be beneficial. That is my advice.
Right, and another common question is about anesthesia during the surgery itself. Our director performs the non-incisional method without the need for sedation anesthesia.
Right.
So why is it that people who opt out of sedation anesthesia often find it extremely challenging and have numerous requests?
That's right.
Why don't people get sedation?
Actually, the concept of sedation anesthesia is not a proper medical term, strictly speaking. It's a pre-anesthetic procedure, like a pre-general anesthesia step. What happens is we give the patient an injection that makes them drowsy and slows their breathing, and we proceed with things in that moment. So, to be precise, it's quite hazardous. You should simply view it in that manner. People believe sedation anesthesia negates the need for local anesthesia here, but that's incorrect. We administer the local anesthesia here while you're asleep from the sedation. Thus, this anesthesia is administered and it's essentially a double dose. I frequently question if such extensive measures are truly warranted. Individuals who prefer sedation anesthesia are often quite anxious or highly sensitive to pain. The issue that arises is that these individuals should experience no pain upon awakening from the sedation anesthesia. Therefore, to ensure no pain is felt, a greater quantity of local anesthesia must be administered in these areas. Any doctors watching this might question, why is he explaining it that way? But truthfully, that's just how it is. That's because if the patient wakes up and expresses discomfort, the entire process would be stalled, wouldn't it? So for the patient to feel nothing upon waking, the anesthesia itself has to be stronger and more of it has to be used. But recovering from that anesthesia falls squarely on the patient, so issues like swelling, the discomfort from needle pricks, and various inflammatory responses are ultimately what the patient must endure. However, as my goal is to enhance hair density, I am particularly worried about any factor that could potentially reduce the graft survival rate. Consequently, I opted for local anesthesia to effectively minimize post-operative swelling. I really try to focus on the surgical results, so I tend to use local anesthesia. I think that explains my approach.
Speaking of surgical methods, there are several, right? The incisional method, non-incisional, and no-cut. Those three main types. Is there a particular reason you almost never do the incisional method and focus on non-incisional?
Non-incisional is more fun.
Oh, so it's just for fun?
No, and regarding the incisional method, what I dislike most is my inability to foresee the results. You see, we make an incision. Depending on the patient's scalp elasticity and the extent of tissue removal, a scar can form, along with uncomfortable sensations in the back, such as a pulling feeling. So even if my surgical skills are excellent, the transplant results might be good, but the occipital scalp could suffer.
I had a male client come into my shop who underwent the incisional method, and upon careful observation of the back of his head, I noticed the hair along the incision line was protruding slightly. So when I was cutting his hair, it felt a little odd and uncomfortable. And it turned out he'd had the incisional procedure. That's why men usually don't get the incisional method, but women do.
Right?
Women, many
That's been
incisions.
the trend lately.
But the incisional method always requires sedation anesthesia?
Not necessarily.
Oh.
The incisional method can actually be performed without sedation anesthesia. However, patients often have unpleasant memories, so we frequently induce sedation to prevent that sensation. Because patients will actually feel the sensation of the scalp separating during the procedure. This is not a pleasant sensation for them, so we prefer not to subject them to it.
What about those with hair volume unsuitable for the non-incisional method? For individuals with limited hair density at the back of their head, I've heard that opting for the non-incisional method might actually make their hair appear even sparser. What would be the most suitable strategy in such cases?
Thus, with the incisional method, sufficient hair volume isn't secured unless cuts are wide or long. So, on a scalp with lower density, if follicles are harvested evenly, the non-incisional method actually has a much higher probability of successful harvesting without any problems. The problem is, if someone has low density or poor hair quality here, the front area isn't likely to be in great shape either. In such a scenario where abundant hair volume is required, employing the non-incisional method alone won't realistically yield the desired amount of hair. So whether you choose the incisional or non-incisional method, you have to lower your expectations for the surgery, which might lead to lower satisfaction. Yeah, that's a factor.
Okay, almost done. Most often people ask, how many centimeters is your forehead? Oh yeah, right, I even measured it myself.
How many centimeters? And how long have you done hair transplants?
This is really truly the last thing.